Dear colleagues, in this video we are going to talk a little bit about fluid in wet age-related macular degeneration. As we all know, fluid is the main biomarker to indicate treatment of maculanovascularization in wet AMD. It is crucial that we understand the types of fluid, the cause of fluid and their implications to optimize resources and improve outcomes. The first concept I'd like to present to you is about the tolerance to fluid. Some colleagues have zero tolerance to any type of fluid, while others have some tolerance. How do we detect fluid? Fluid is usually that black or dark hyperreflective sign on OCT. It can be intraretinal fluid, subretinal fluid, or even sub-RPE fluid. However, it's not only about fluid. When we examine patients with AMD, we need to do a good eye exam, best correct visual acuity, search for new bleeding, and perform additional tests to OCT like fluorescein angiography or OCTA. What causes fluid? So macular neovascularization is highly VEGF driven. The neovascularization in itself has multiple vascular endothelial cells that produce high quantities of VEGF, and we know that VEGF is a powerful enhancer of vascular permeability, much more potent than histamine, for example. So if we see those black or dark hyperreflective signs, there is a high chance that this is VEGF mediated. However, new hypotheses have arisen about those dark or black hyperreflective spots that we all call fluid. There is a hypothesis that they can be degenerative, like outer retina tubulations or degenerative cysts. The bus of my children are here next door. So those black or hyperreflective signs can be also degeneration. There is another theory that those hyperreflective signs could be, for example, death of Müller cells or impairment in the RPE pump in a case of, for example, of subretinal fluid. How do we know if those hyperreflective signs are VEGF mediated or not? We can treat patients with more often injections, for example every 2 weeks, to find out if the fluid disappears. We can also extend injections to evaluate if the fluid increases. Or we can also perform fluorescein angiography to detect leakage. So these are the three methods that are possible to differentiate between VEGF mediated or neovascular activity fluid to other types of signs of hyperreflective, like degeneration or failure in the RPE pump or Müller cells. Let's talk a little bit about subretinal fluid. We all heard about the fluid study that concluded that a little bit of subretinal fluid may not affect final outcome. However, this is not totally accepted, as many or most retina specialists have or believe zero tolerance is much better for our patients. This is very important in the PRN approach or in the treat and extend approach, as we usually use fluid as a key biomarker, as we talked before. So in this little talk we talked about fluid, the assessment of fluid and possible theories of fluid. I hope you like this little talk, and we continue to talk or watch lectures tomorrow. Have a great day or evening. Thank you.